Good morning, everyone, and welcome to the First Nations Housing Community Webinar Series. Today we have Dr. Lloyd Douglas of the Independent First Nations Alliance here for self-isolation in an overcrowded house, housing and health. But first, we'd like to know where everyone is joining us from. Let us know in the chat at the bottom of your screen where you're joining us. We'd love to know. If you have any questions during the webinar, we have a Q&A session at the end of Dr. Douglas's presentation. Please put your questions in the Q&A box, not the chat, and we will do our best to get to everyone during the session. This webinar is also being recorded and will be uploaded to our website shortly afterwards. Looks like we have some locals and Manitoba, Webakwe, BZA. Thanks everyone for joining us. Now, thank you, Dr. Douglas, for joining us, and take it away.
Good morning, everyone. I hope you're hearing me loud and clear. My name is Lloyd Douglas. I'm a public health and preventive medicine specialist. I graduated from the Northern Ontario School of Medicine, NOSM, in 2019. We also completed my family medicine training in 2016. Presently, I work with the Independent First Nations Alliance as a physician consultant. I'm also supporting the Sioux Lookout First Nations Health Authority COVID-19 Regional Response Team as a planning section lead. I've been living with my family in Sioux Lookout here in Ontario since 2013. And it's an honor and a privilege to talk with you today about housing and health in the context of the ongoing pandemic. Today, we'll look at self-isolation and household crowding, how overcrowded homes in our communities impact health and prevent families from following public health advice. I acknowledge that I'm speaking to you from Sioux Lookout, which is located on the traditional lands of the First Nations of the people of Lac Seul First Nation. I recognize the long history of First Nations peoples in this area, and I acknowledge and wish to show respect to all First Nations in this area. I just want to thank the organizers of the First Nations housing community for this opportunity. I have no conflict of interest to disclose at this time. So today, in terms of the objectives, there are a couple of things that we'd like to cover. And the COVID-19 pandemic exposes the long-standing housing crisis in remote Indigenous communities. And given that housing is a social determinant of health, we will explore how housing and health are related, how housing inequities lead to health inequities, poor quality of life and decreased well-being. We will define housing suitability of private households. We will discuss how a lack of housing in Indigenous communities leads to overcrowded homes and explore the reasons why overcrowded homes are associated with higher COVID-19 infection rates. Lastly, we'll look at how a lack of Indigenous housing prevents families from following COVID-19 public health advice. So to begin the discussion, let's start with a definition of healthy housing. The World Health Organization defines healthy housing as a shelter that supports a state of complete physical, mental, and social well-being. Healthy housing provides a feeling of home, including a sense of belonging, security, and privacy. Healthy housing also refers to the physical structure of the dwelling and the extent to which it enables physical health, including by being structurally sound, by providing shelter from the elements and from excess moisture, and by giving us comfortable temperatures, adequate sanitation and light, sufficient space, safe fuel, and protect us from other pollutants and hazards, including mold and pests. Whether housing is healthy also depends on factors outside its walls. It depends on the local area that this house is located in, which enables social interactions that support health and well-being. And finally, healthy housing relies on the immediate housing environment and the extent to which this provides access to services, green space, and active and public transport options, as well as protection from waste, pollution, and the effects of disaster, whether natural or man-made. The Canada Mortgage and Housing Corporation states that acceptable housing is adequate in condition, suitable in size, and affordable. Accordingly, housing is adequate if it does not require any major repairs according to residents. Housing suitability refers to whether a private household is living in suitable accommodations according to the National Occupancy Standard, NOS. That is, whether the dwelling has enough bedrooms for the size and comparison of the household. To get the thumbs up, a household is deemed to be living in suitable accommodations if its dwelling has enough bedrooms as calculated using the National Occupancy Standard. Worldwide, crowding is often a marker of poverty and social deprivation. Crowding is considered to be stressful to health and well-being. Household crowding is defined as a condition where the number of occupants exceeds the capacity of the dwelling space available, whether measured as rooms, bedrooms, or floor area, resulting in adverse physical and mental health outcomes. Crowding is a result of a mismatch between the dwelling and the household. The level of crowding relates to the size and design of the dwelling, including the size of the rooms, and to the type, size, and needs of the household, including any long-term visitors. Whether a household is crowded depends not only on the number of people sharing the dwelling, but on their age, their relationship, and their sex. For example, a dwelling might be considered crowded if two adults share a bedroom, but not crowded if those adults are in a relationship. Crowding relates to the conditions of the dwelling as well as the space it provides. People may crowd into particular rooms in their home to avoid cold parts of the dwelling or to save on the heating and other costs. So crowding is considered to be, again, stressful to health and well-being. The Canadian National Standard assesses the bedroom requirements of a household based on the following criteria. There should be no more than 2 persons per bedroom. Children less than 5 years of age of different sexes may reasonably share a bedroom. Children 5 years of age or older of opposite sex should have separate bedrooms. Children less than 18 years of age and of the same sex may reasonably share a bedroom, and single household members 18 years or older should have a separate bedroom, as should parents or couples. Using this measure, households that require at least 1 additional bedroom are considered to experience some degree of overcrowding. The standard is related to international standards on crowding, and this standard was approved as a departmental standard on January 21, 2013 to current. In 2016, close to 1/5 of the Aboriginal population or Indigenous population lived in housing that was considered not suitable. Just over 1 in 10, actually 11.5%, Indigenous people lived in housing with a 1-bedroom shortfall. 4% lived in housing with a 2-bedroom shortfall, and 2.8% lived in a dwelling with a shortfall of 3 or more bedrooms. 24.2% of First Nations people lived in a dwelling that was in need of major repairs in 2016. Now, when we look at the key health risks related to housing, there's a strong and well-established body of evidence that states that various biological, chemical, and physical exposures in the home have adverse health effects. According to the World Health Organization, Housing and Health Guidelines, which state improved housing conditions can save lives, prevent disease, and increase the quality of life, reduce poverty, and help mitigate climate change. And poor housing conditions are associated with a wide range of health conditions, including respiratory infections like asthma, lead poisoning, injuries, and mental health. In particular, crowded housing increases the risk of exposure to infectious diseases like influenza and COVID-19. Inadequate water supply and sanitation facilities affect food safety, personal hygiene, and therefore lead to the development of these infectious diseases. Poor housing can expose people to several health risks. For example, structurally deficient housing due to poor construction or maintenance can increase the likelihood that people may slip or fall, increasing the risk of injury. Poor accessibility to homes may expose their disabled and elderly residents to the risk of injury, stress, and isolation. Housing that is insecure, sometimes due to affordability issues or weak security of tenure, is stressful. Housing that is difficult or expensive to heat can contribute to poor respiratory and heart and death from heart disease. Indoor air pollution harms respiratory health and may trigger allergic and irritant reactions such as asthma. Crowded housing increases the risk of exposure to infectious diseases and stress. Inadequate water supply again and sanitation problems, I'll repeat, does affect food safety and personal hygiene. Now, housing inequities lead to health inequities. Housing is a social determinant of health. It is one of the mechanisms through which social and economic inequities translate into health inequities. Upstream policies outside the sphere of health in the area of housing and related areas such as income security and employment play a paramount role in shaping the social and economic context in which people live. Differential access and exposure to social determinants of health, such as housing, can in turn create or worsen health inequities. Now, figure 1, which is a very complex figure, attempts to simplify a complex relationship between housing and health and other social and economic factors. It is recognized that many of the factors within each of the boxes are interrelated. For example, violence can lead to family breakdown, which can lead to poverty. The list of health inequities are a mix of health-related behaviors and health outcomes, and different housing dimensions are associated with different health-related behaviors and outcomes. The high cost of housing and insufficient supply of good quality, affordable, supportive, and accessible housing in combination with social and economic inequities such as poverty can result in people living in poorer quality housing or neighborhoods or communities with less access to factors important for health. The high cost of housing and low supply of affordable housing can lead to affordability issues, which can lead to reduced expenditures on food, which leads to food insecurity. And all of this impacts health. Social and economic inequities, such as discrimination and violence or abuse, can lead to housing instability, such as couch surfing, overcrowding, doubling up, and homelessness, which can in turn affect health. Substance use can lead to evictions and homelessness, either directly or indirectly through poverty and unemployment. This can either amplify existing mental and or physical health issues or lead to other health issues. Physical disabilities or chronic illnesses can lead to social and economic inequities, such as unemployment and poverty, which in combination with an insufficient supply of accessible, affordable housing can amplify these health issues, making their treatment and management more challenging or leading to further health issues. Poor housing conditions are one of the mechanisms through which the social and environmental inequality translates into health inequality. Simply, this just means poor housing may lead to poor health. This inequality in housing conditions goes beyond whether people are rich or poor. Almost half of First Nations adults and children live on reserve. More than a quarter of unreserved First Nations live in crowded homes, a rate that is 7 times greater than that of non-Indigenous people. Furthermore, 43% of First Nations houses on reserve are in need of major repairs, compared to only 7% of Canadian houses. The poor housing conditions on reserve First Nations are contributing to many health and social problems. Approximately 27% of First Nations people living on reserve were living in crowded conditions back in 2011, about 7 times the proportion of non-Indigenous people nationally. Overcrowding in conjunction with remoteness has been associated with the increased rates of infectious illnesses. Back in 2015, the Standing Senate Committee, for example, reported that unsuitable and inadequate housing has resulted in First Nations people dying at a rate 10 times higher than the national average due to house fires. So poor housing leads to poor health or poor health outcomes. Let's switch gears and talk about the pandemic just for a bit. So you know, on December 31, 2019, the world changed when the Chinese health authorities identified a new coronavirus through a series of reported cases of pneumonia in Wuhan, China. We know the symptoms. They include fever, cough, difficulty breathing, pneumonia, so forth, so on. In severe cases, as we see in the news almost daily now, and this is very unfortunate, death can be an outcome. Now, the maps that I'm showing right now, there's a map on the left and there's a map on the right. The map on the left displays the current situation regarding the rate of active cases of COVID-19 in Canada per 100,000 population, with Manitoba having the highest rate of active cases as of December 1st, 2020. On the right, we have the count of active cases as of December 1st, 2020. And you can see that here in Ontario, we are well into the second wave of this pandemic. Now, this slide is a bit busy, but this slide provides a summary of the week of November 17th, 2020, from the First Nations and Inuit Health Branch COVID-19 epidemiology update. Now, figure 1 shows a sharp increase in the number of newly reported and active COVID cases in First Nations, with most cases in Manitoba, Saskatchewan, and Alberta beginning round about September and October. You can see that graph, that line going up. Now, figure 2 is a table of COVID indicators that compares the general population of Canada versus First Nations in Canada. And when you look at the rate, you can see that the COVID-19 cases rate per 100,000 is higher among the general population. Hospitalizations are higher, and the case fatality rate all are higher. All these rates are higher in Canada in the general population than in First Nations. Now, figure 3 shows the newly reported COVID-19 cases in First Nation communities by probable exposure and episode date. Now, again, we see a sharp increase in cases since October, and most cases have no established epidemiological link. That means that most cases did not have common characteristics linking them to another case, such as a close contact, symbolized by the blue section of the bars. However, some cases are related to household and community exposure, the respective red and green sections of the bar. Now, when you look at measures that are recommended to control COVID-19, according to the Public Health Agency of Canada, in order to reduce the spread of COVID, we have been told to follow the advice of your local public health unit, wash your hands often with soap and water for at least 20 seconds, use an alcohol-based hand sanitizer containing at least 60% alcohol if soap and water are not available. Try not to touch your eyes, your nose, your mouth. Avoid close contact with people who are sick and practice physical distancing. Cough and sneeze into your sleeve and not your hands. Stay home as much as possible. And if you need to leave the house, practice physical distancing approximately 2 meters. And if you have any symptoms of COVID-19, you should isolate at home to avoid spreading illness to others. Now, isolation means staying at home when you have a symptom of COVID-19, and it is possible that you have been exposed to the virus. That's what they mean when they say isolation. If you have symptoms, if you think you're exposed, stay at home. Now, one very important recommendation is to stay in a separate room and use a separate bathroom from others in your home if possible. Now, a report from the Wellesley Institute entitled Crowded Housing and COVID-19 Impacts and Solutions states, the evidence in Toronto is clear. Overcrowded housing is associated with increased COVID-19 infection rates. In the city of Toronto, overcrowded housing conditions have left 12% of private households more vulnerable to contracting the virus. It is reported that the number of COVID-19 cases is nearly 4 times higher among people living in areas of the city with high levels of overcrowding. And the data shows that these are the same areas with high concentrations of poverty and racialized areas. If that's the case down south, imagine what's happening in the north. Now, in May of this year, the Canadian Centre for Policy Alternatives in Manitoba published a report entitled COVID-19, First Nations and Poor Housing. In the report, it states, asking people to wash their hands and isolate in overcrowded homes without running water is like asking people unable to afford bread to eat cake. This article analyzes Canada's directive to isolate in place and to wash your hands to reduce public health risks from COVID-19, considering the triple jeopardy faced by many First Nations. And that includes healthcare, and infrastructure. We know that these entities in our communities, they're not where they're supposed to be. The Public Health Agency of Canada recommends that people isolate at home if they may have COVID-19. However, this public health advice is difficult to adhere to in overcrowded homes on First Nation reserves. The article quotes Grand MKO Chief Garrison Settee, who stated, with the COVID-19 pandemic, however, we do need to pay attention to the lack of housing as it directly impacts our ability to follow public health advice designed to mitigate the impacts of the virus on the vulnerable citizens in our communities. The article continues by saying, or the report continues by saying, in conclusion, federal programs do not provide adequate, safe, and healthy housing on First Nation reserves, making First Nation people on reserve at higher risk from COVID-19. The Assembly of First Nations in 2020 estimates that an additional 130,000 housing units are needed by 2030. Now, as early as March 11, 2020, a CBC article reports Chief Munias of Nishkandiga saying, overcrowded housing could make self-isolation impossible. Now, very early on, as early as March 11, Chief Munias was saying this, overcrowded housing could make self-isolation impossible. Chief Munias said that preventative measures may not be enough in many remote First Nations, which face a shortage of housing. How can we be prepared, he says, if we are asked to be put under self-isolation when there is overcrowded housing, 2 or 3 families living in one house? How are you going to self-isolate? That's Chief Munias, as early as March. Now, Josh Holden and Peter Kenway from the UK asked a similar question. How hard is it to self-isolate at home? They said, it's not hard at all if you're empty nesters with a choice of bedrooms to hide away in. But if you're a family with no rooms to spare, and especially if you're not just parents and children, but there are grandparents too, then it may be impossible, and I repeat, impossible to observe the social distancing rules if one person starts to show symptoms. The danger this poses to the more vulnerable members of the household is obvious. Now, the same CBC article quotes Indigenous Services Minister Mark Miller saying, we have our experience from H1N1 and we know that overcrowding poses a real threat to people's health for a number of reasons. Miller told, the minister said that his department's health branch is aware of the problems overcrowding poses to the need for self-isolation. He continues by saying, in an overcrowded situation, it will be much more difficult to self-isolate, so we need a strategy to approach that. And we have a specific approach to reach out to communities, by speaking with them directly, speaking to their chiefs, speaking to the health stations, the nursing stations, but also speaking directly with the public. So very early on, this problem of overcrowding and the impossibility of many First Nations families being able to self-isolate was recognized both by First Nations leadership and by provincial and federal leadership. Now, preventing contagions reaching at-risk First Nation reserve communities until a vaccine is achieved is the key way to stop transmission of COVID-19. And the main response to the pandemic has been this: First Nation leadership's decision to lock down borders, which they have done, should be fully respected and supported. This has been the main measure that has kept COVID-19 out of the communities. Now, this is happening all over the country, especially since the second wave, which is much worse than the first. It's happening right now. SLIFNA, in the slide, you'll see this little figure to the bottom. SLIFNA, the Sulukot First Nations Health Authority, provides a travel advisory to First Nations in the region to assist communities in making decisions around essential and non-essential travel restrictions. The current requirement in most communities is to quarantine for 14 days after return from essential or non-essential travel. This is considered the safest and most conservative option, but has significant issues in terms of resources requirement, adequate isolation facilities, and its undesirable potential as a deterrent to seeking necessary care. Community lockdowns have had a negative impact on community members' mental well-being. In addition, lockdowns affect travel to and from medical treatment, and delays or cancellation of essential medical treatment may lead to excess deaths in the future. Now, given the underlying challenges with housing in First Nation communities, communities had to come up with other solutions to address the problem of isolation or quarantine when this cannot be done safely at home. To that end, the Sulukot First Nations and other partners developed a reference document intended to provide technical guidance, recommendations, and minimum requirements for establishing and operating alternate COVID-19 care sites. Alternate COVID-19 care sites refer to COVID-19 assessment, quarantine, and isolation sites. At these sites, patients with possible COVID-19, their contacts, and those who are suspected or confirmed cases can be assessed. They can stay there and they can receive appropriate care while reducing transmission of COVID-19 in the community. Now, since care will be provided in a non-traditional clinical setting, such as schools, hotels, and other buildings, it is important to ensure that these buildings, these infrastructure can support the implementation of recommended requirements and infection prevention and control measures. Now, some First Nations in the Sulukot First Nations area were able to establish these alternate sites. Others were not so fortunate. Many communities quickly ran out of the resources to maintain these sites. So many communities are now back at square one. Indigenous Services Canada has supported, to a certain degree, the retooling of existing structures in some First Nations communities in the region, but many communities are still lacking adequate facilities. Indigenous Services Canada has also distributed a limited amount of other solutions like the Blue Med Tent and the Matrix Unit. However, regarding the Blue Med Tent, there are some disadvantages. which include this tent-like structure makes it uncomfortable to live in for any length of time. There's no sanitation facilities, no showers, no toilets, no water supply, even though holding tanks can be provided. And it's not sure if the Blue Med tent can stand up to the extreme temperatures that we face in the north, especially like how winter is here. That being said, SLIFNA and other partners, the tribal councils and NAN has been continually supporting communities in securing funding and seeking to secure funds to carry out essential services related to COVID-19 response. The finance team at SLIFNA is actively, along with NAN, advocating on behalf of communities to ensure that no one is left behind. And to this end, the team is now working closely with Indigenous Services Canada to align more closely the funding, all the funding points that are needed to ensure that the best proposal is put forward and that these communities can obtain suitable isolation facilities. Now, close to home in Northwestern Ontario, we see the situation worsening. Our neighbors in Manitoba, they have the highest rates of COVID-19 in the country, and the Northern First Nation communities are affected. And adequate housing with the ability to safely, adequate housing has the ability to safely control, and is the key to safely control the outbreaks that we're seeing. Now, on November 30th, 2020, just this week, there were 60 known active COVID cases in Shamattawa First Nation, including 30 to 35 isolating off reserve, according to Chief Eric Redhead. Chief Redhead said that these numbers are really, really scary. He said that he feels lost and that they have deployed all the resources that they have. And he continued to say that his people are scared, their loved ones are scared. But this struck me. He said, I truly believe that if we had adequate housing and were able to keep safe distance from one another, then it wouldn't be as bad. And you know what? I fully believe what Chief Redhead is saying. Now, part of that concern stems from overcrowding in homes. There have been several instances where more than a dozen people living in the same home were forced to leave because they all tested positive for COVID-19 and had to isolate elsewhere, Chief Redhead said. More than half of the 63 First Nations in Manitoba have reported a case of COVID-19. And First Nations in Manitoba, First Nations people account for 19% of the province's total known active COVID cases, a quarter of the hospitalizations, and 17 patients in intensive care, according to the Manitoba First Nations COVID-19 bulletin issued this past Monday. So it's clear, adequate housing can help to control COVID-19, and without adequate housing, disasters like what we're seeing, the unfortunate situation of what we're seeing happening right now in First Nations in Manitoba, in Saskatchewan, in Alberta, will happen. Now, the government of Canada, just to compare with what's happening down south, the government of Canada, this is a news release, the first one, September 11. The government of Canada announces funding for voluntary self-isolation centers in Toronto. On November 26, the government of Canada announces funding for new COVID-19 self-voluntary isolation centers in Peel, Ontario. The news release went on to say that In Toronto, the Minister of Health and the Mayor, John Tory, announced $13.9 million in funding over 12 months for Toronto Public Health, which will provide 140 rooms for, in order to provide a safe venue for voluntary self-isolation. Last week, the health minister announced $6.5 million funding over 16 months for Peel Public Health to establish a safe voluntary isolation site. It would be great if we could get a similar announcement for each First Nation community. I repeat, it would be fantastic, awesome, if we could get a similar announcement for each remote First Nation community. Now, in conclusion, housing is an important social determinant of health. And housing is more than just shelter and includes the social and psychological aspects of the home, the physical structure, its design and characteristics, the immediate physical area around the building, the social characteristics and range of services in the neighborhood. Housing is also a health equity issue. Quoting from the Crowded Housing and COVID-19 Impacts and Solutions article, which states, in addition to overcrowding, a fulsome response should also consider quality, safety, and comfort. We know that investing in good quality, suitable, and affordable housing is an investment in health. And if we want to protect the health and well-being of our residents beyond COVID-19, we need to think about larger and more permanent solutions. We also need to explicitly embed more solutions informed by public health research and best practice into housing policy. Healthy housing is a broader public health issue, not just an issue during this pandemic. It's time we seriously evaluate the health impacts and invest in affordable housing and new approaches, including public health, to address them. Thomas et al. States that the First Nation infrastructure crisis is more than a building problem or a health problem for COVID-19 transmission and healthcare. It is a colonial systems problem. Thank you so much. This is where I'll end, and I'll turn it over for questions, and I'll try to see if I can answer them. Thank you for listening.
Thank you, Dr. Douglas. We have our first question already from Daniel Gaspé. Sorry if I get names wrong, everyone. So I think he's referring back to one of the figures. It's figure 3. I believe it was a chart with where the COVID-19 cases came from. So could the red part of the graph in figure 3 grow to show household exposure is actually much higher if data could be found to support that result? What is the access to the data barrier to identify sources or types of exposure?
Thank you so much, Daniel, for that question. That's a very great question. I totally agree with you that one of the barriers or one of the limitations in the data is, are we getting the right data? I mean, are we asking the right questions when we're doing kind of the case and contact tracing? Are we getting those answers? I believe possibly that in some situations, there could be some underreporting of the impact of the lack of housing or the poor infrastructure with regards to housing, the impact that that's having on the transmission of COVID-19. And that's why it's key that when, the healthcare providers and those in public health, when they're asking about contacts. They should ask about the housing situation. What are the living conditions? Are you able to appropriately and safely self-isolate at home? These are very important questions. To be truthful, I am not entirely sure if this is done at every single time for every single interview when there is a case on within our communities or there's an outbreak in the communities. So that red section, the household exposure, could be much larger if we were hammering down and getting and collecting the appropriate information. So what I'd say, ensure that in your community, and what we have done um, at the Sulukot First Nations Health Authority is that the health authority works with the community around contact tracing and case management. There's a contact tracing team on the ground in the community that includes community members that know the community very well. So for example, you may have a nurse at the health center or the nursing station that they may be so busy, they may not drill down and hammer down and get the information with regards to housing. But community members, if you're involved in that process, you can clearly articulate that for this contact or for this case, this is the housing situation. And that's what we need to do more of. We need to get good information, and the way to get good information is to include the community, involve the community as a part of this process. I've always said that the true experts are community members. One, you know your community, you speak the language, you know the family relations, you get it. So working together with community members will help us to get the data, the right data that we need so that we can make better decisions moving forward, especially related to household exposure and the transmission of COVID-19. Hope I answered your question. Thank you.
Thank you, Dr. Douglas. So I encourage everyone, if you have any questions, please put them in the Q&A section on the bottom of your screen. But for now, I have a question for you, Dr. Douglas.
Go ahead.
So in your opinion, what can be done now to improve isolation capacity in remote First Nation communities?
Thank you so much for that question. What we need to do now is we need to come together. I've read recently that we should never ever waste a crisis. I think we need to make a very loud cry to all the provincial leaders, the federal leaders, to our own leadership to say, we need to fix the housing crisis here and now. So we need to kind of sound that alarm, get that message out there loud and clear. In the meantime, the federal government and the provincial governments, just as how they can make announcements and provide funding to communities down south, non-Indigenous communities, they should be doing that for First Nations people. And I know that there are a number of partners in our region that's weekly, daily, advocating for more resources to address issues related to isolation and quarantine. So I know that individual communities have done that. They have sent their submissions to Indigenous Services Canada. Tribal councils have done that. Independents have done that. The health authorities have done that. NAN is doing that. We need to all rally behind this process so that, one, we can get funding for temporary housing, whether it's going to be some modular solutions right now to get them up on our winter roads when our winter roads are in. And I know that there are several pockets of funding, But when you look, the government may announce, in the feds or the province, there's so much millions of dollars or so many millions of dollars. But when you look at it, for each First Nation, it comes down to peanuts. So we need to make a concerted effort to request funding. We have all the data. We now have the evidence. We have, and I'll put this in quotation marks. We see this kind of live experiment that's happening right now in First Nations communities in Manitoba, Saskatchewan, Alberta. We cannot wait anymore. We need to rally and advocate to all the leaders to say, please, one, provide a temporary solution, and two, start looking at a long-term plan. If we need 130,000 units by 2030, what's the plan for that? We need to see those plans, and not just a plan. We need to see the resources following those plans. And we need to start putting these homes, safe homes, affordable homes, suitable homes, acceptable homes in our communities.
Thank you. All right, looks like we have another question from Corey Tarbell. What problems result from high CO2, 1500 ppm to 2500 ppm in the home, and low 19.5% oxygen levels? This is a result from wood burning appliances and conventional oil wood stoves and high occupancies. I'm not sure how closely related that is to COVID-19, so it may not be your type of question, but let us know what you think.
So thank you so much for the question. I think that there's another presentation from the team at NAN. They're looking specifically at their experience with regards to this question. Check that webinar out. I know that they'll provide you with an answer, but I'll say this. Years and years of long-standing indoor air pollution, which pretty much comes down to smoke in the house, one, has made First Nations people more susceptible and more vulnerable to COVID-19 because of the poor respiratory function or lung function that results from being exposed to indoor air pollution for such a long time. So I'll just answer that question in a nutshell. First Nations people who have been exposed for a long time to indoor air pollution are more susceptible to COVID-19 and to having more severe complications, respiratory complications, because of indoor air pollution, if they should contract this virus, if they should come down with the disease called COVID-19. So thank you so much, Corey, for that question. Again, check that other webinar out from NAN.
Awesome, thanks again. And I think we have time for one last question. It's from Wayne Strachan. Sorry again if I got the name wrong. So he says, we have isolation units set up with a nursing station in case of an outbreak in our community. Do you have any recommendations? What items should be included in these units for the safety of the occupants?
Okay, awesome. That's an excellent question. And I'm just looking back to my slide. Where do I have it? Just give me one quick second. I'm just going to share my screen again, and I'll make reference to this slide. So you're seeing my screen. So if you check the Sulukot First Nations Health Authority website under the COVID-19 kind of tag, you'll find some resources there on the website. And one of the documents that we have prepared, it's called the Alternate COVID-19 Care Sites. It's a tool that speaks to pretty much everything that you need to know with regards to implementing and setting up an isolation unit, all the infection prevention and control, what to do with regards to ventilation, what to do with regards to sanitation. In a nutshell, in the interest of time, Wayne, check out our website. If you go there, and I'm wondering if I could do this. Let me just try this and see if it's gonna work for me. Let me see if I could bring the website up. Just bear with me 2 seconds. Let me see if I can share the screen. Slifna, COVID. So that the participants can have an idea as to what I am talking about. I'm almost there. Let me share this one. Let me minimize that. So this is the website that I'm talking about, where you can find COVID-19 information, and you have COVID-19 resources. And for community leaders, let's see if this will work. When you come here, you find a number of resources, and on the website, here it is. You have alternative care sites technical guidance. This is where you'll find that document that can provide you with all the recommendations and all the guidelines that may be fit for your purpose. So check this out. If you're having problems with the link, please just send an email to the organizers of this conference, and I'll make sure that they provide you with a PDF of this document. Thank you so much.
Awesome. Yeah, we'll definitely get that included on the First Nations Housing Community website, along with the recording for this presentation. I think that's all the time we have for today. So thank you, Dr. Douglas, for joining us.
You're welcome. It's been a pleasure. I wish I could see you all.
All right, awesome. So just wanted to thank everyone for joining us again for today's webinar. Remember, we want to hear from you about the topics that you want us to cover in future webinars, any ideas you have, success stories you would like to share, mistakes we can learn from, projects you have done, and more. Visit our Facebook page at facebook.com/FNHCOMM to share. We also have a survey that will open in the window right after this. We would really appreciate your thoughts and feedback. Don't forget, we have one more webinar in the series, as Dr. Douglas mentioned, is Improving Woodstow Safety in First Nations with Anishinaabe Nation. You can register on our website, firstnationshousingcommunity.com. And you can also subscribe online to get our latest updates, news, and other webinar information right in your inbox. Thanks again for joining us, and have a great day.
Thank you so much. My final word with everyone from a public health perspective, being a public health doc, remember the 3 C's that you need to avoid. Avoid crowded places, avoid enclosed spaces, avoid close contacts. Remember the 3 W's that you need to do. Remember to wash your hands, remember to wear your mask, and watch your distance. Have a good day, and please be safe. Thank you so much. Bye, everyone.